Your hands have betrayed you again. This morning, as you reached for your coffee mug, that familiar sharp pain shot through your fingers like lightning, forcing you to pause and wince before carefully adjusting your grip. You remember when your hands were your most reliable tools? When buttoning a shirt took seconds instead of minutes? When opening a jar didn't require strategic planning or asking for help? Now, these hands that once moved with confidence and grace feel like foreign objects attached to your wrists, stiff and unreliable, making even the simplest daily tasks feel like mountains to climb. You have probably tried everything your doctor suggested, from expensive prescription anti-inflammatory medications that promise relief but deliver stomach problems and dizziness, to physical therapy exercises that seem to make the pain worse rather than better. Friends and family members mean well when they suggest you just need to stay positive or try the latest miracle supplement they read about on social media. But they do not understand the profound frustration of living with hands that no longer obey your commands. The truth is, hand arthritis steals more than just physical comfort. It steals your independence, your confidence, and your sense of being fully present in your own life. You find yourself declining invitations because you are not sure if your hands will cooperate when you need them most. You avoid handshakes because the pain makes you grimace involuntarily. You watch other people effortlessly perform tasks that now require your complete concentration and multiple attempts. This is not just about pain. This is about feeling like your body has turned against you, leaving you isolated and frustrated in ways that people without chronic pain simply cannot comprehend. I am Dr. Lauren, and over the past 15 years of practicing integrative medicine, I have worked with thousands of patients who describe their hand arthritis exactly the way you might describe yours. The mornings when your fingers feel like they have been locked in place overnight. The evenings when simple tasks like turning a doorknob or holding a book become exercises in pain management. The social situations where you smile and pretend everything is fine while your joints scream in protest. What I have discovered through both clinical practice and extensive research is that the conventional approach to hand arthritis is missing something crucial. Most treatments focus on managing symptoms rather than addressing the underlying mechanisms that create and maintain chronic joint inflammation. Today, I want to share with you a technique that has transformed the lives of my patients, a simple 1-minute massage that targets a specific pressure point most people have never heard of, but which can provide almost immediate relief from hand pain and stiffness. Before we dive into this technique, I need you to know that I understand your skepticism. You have probably been disappointed by promises of quick fixes before. You have tried medications that did not work, supplements that made no difference, and exercises that seem to make things worse. The approach I am about to share with you is different because it works with your body's natural healing mechanisms rather than trying to override them. This is not about masking pain or forcing your joints to behave differently. This is about activating your body's own anti-inflammatory and pain relief systems in a way that most healthcare providers never learn to teach their patients. The technique I am going to show you focuses on a pressure point that traditional Chinese medicine practitioners have used for thousands of years, but which modern research has now validated through multiple clinical studies. This point, located in the web of skin between your thumb and index finger, is connected to a network of nerves and blood vessels that directly influence circulation and inflammation throughout your entire hand and wrist. When stimulated correctly, this point triggers the release of natural pain-relieving compounds in your body, while simultaneously improving blood flow to the joints that need healing the most. The beauty of this approach is that it requires no equipment, no expensive treatments, and no side effects. You can perform this technique anywhere, anytime you need relief, and it becomes more effective the more consistently you use it. Let me explain exactly why this technique works so powerfully for hand arthritis pain. Your hands contain more nerve endings per square inch than almost any other part of your body, which is why hand pain can be so intense and debilitating. These nerves are constantly sending information to your brain about pressure, temperature, and movement. But when joints become inflamed, these same nerves begin sending pain signals that can overwhelm your nervous system. The pressure point we are going to work with acts like a reset button for these overactive pain signals. When you apply pressure to this specific location, you activate what researchers call the gate control theory of pain. Essentially, you are sending competing signals to your brain that interrupt the pain messages coming from your inflamed joints. At the same time, the pressure stimulates the release of endorphins, your body's natural painkillers, while improving circulation to carry away inflammatory toxins that have been building up in your joint spaces. Here is exactly how to perform the technique that has brought relief to so many of my patients. First, hold your left hand in front of you with your palm facing toward your body. Look at the web of skin between your thumb and index finger. You will notice that this area forms a small valley or depression when you bring your thumb and finger together. This is the location of the pressure point that traditional Chinese medicine calls Li4, or large intestine 4, though you do not need to remember that name to benefit from its power. Using your right thumb, place firm but comfortable pressure directly in the center of this web of skin. You should feel a slight tenderness or sensitivity, which tells you that you have found the correct location. This tenderness is completely normal and actually indicates that the point is responsive and ready to provide relief. Now, instead of just pressing and holding, which is what most people try to do, you are going to create a specific pattern of pressure that maximizes the therapeutic effect. Press firmly for 3 seconds, using enough pressure that you feel the tenderness, but not so much that it causes sharp pain. Then release the pressure completely for 2 seconds, allowing the blood flow to return to the area. Repeat this pattern of 3 seconds on, 2 seconds off, for a total of 1 minute. As you perform this technique, you may notice that the initial tenderness begins to fade, replaced by a sensation of warmth or tingling that often spreads throughout your hand and fingers. This is exactly what should happen and indicates that the technique is working to reset your pain signals and improve circulation. After completing the full minute on your left hand, switch to your right hand and repeat the exact same process. Hold your right hand with the palm facing your body, locate the web of skin between your thumb and index finger, and use your left thumb to apply the same pattern of pressure. 3 seconds on, 2 seconds off, for 1 full minute. Many of my patients report feeling immediate improvements in flexibility and pain reduction even before they finish the second hand. This is because the nervous system connections between your hands are so intimate that stimulating the pressure point on one side begins to create benefits on both sides of your body. What makes this technique so remarkably effective is not just the immediate relief it provides, but the cumulative benefits that develop when you use it consistently. In my clinical practice, I have observed that patients who perform this simple massage twice daily for just 1 week often experience improvements that rival those achieved with prescription medications, but without any of the side effects or long-term health risks. The pressure point massage works by addressing multiple aspects of hand arthritis simultaneously. It reduces acute inflammation by improving lymphatic drainage, decreases pain sensitivity by modulating nerve signals, improves joint flexibility by increasing blood flow to cartilage and synovial fluid, and enhances your body's natural healing capacity by activating the parasympathetic nervous system. I want to share with you the story of Margaret, a 58-year-old teacher who came to my practice after struggling with hand arthritis for over 3 years. Margaret described her mornings as torture, spending the first hour after waking slowly coaxing her fingers to bend and straighten enough to hold a coffee cup or brush her teeth. She had tried multiple prescription medications, but each one either provided minimal relief or caused side effects that made her feel worse overall. Margaret was considering early retirement because the constant hand pain was making it difficult to write on the blackboard or grade papers for more than a few minutes at a time. When I taught Margaret this pressure point technique, she was skeptical because it seemed too simple to address such a complex problem. However, she agreed to try it twice daily for 1 week. On her follow-up visit, Margaret reported that she had experienced noticeable improvements in hand flexibility starting on the 3rd day. By the end of the first week, her morning stiffness had decreased by about 60%, and she was able to write for extended periods without the sharp pain that had been limiting her professional activities. 6 months later, Margaret continues to use this technique daily and has been able to maintain her teaching career without relying on prescription medications. The reason this technique succeeds where many conventional treatments fail is that it addresses the root mechanisms of arthritis pain rather than simply masking symptoms. When you take anti-inflammatory medications, you are essentially blocking your body's inflammatory response system-wide, which can interfere with normal healing processes and create potential side effects in your liver, kidneys, and digestive system. When you perform pressure point massage, you are working locally to reduce inflammation and pain in the specific area that needs attention while supporting your body's natural healing mechanisms. This targeted approach explains why patients often experience better results with fewer unwanted effects compared to pharmaceutical interventions. Let me share another success story that illustrates the power of this approach. Robert, a 62-year-old carpenter, had been living with severe hand arthritis for over 5 years when he first came to see me. His hands were so stiff and painful that he had been forced to give up the woodworking hobby that had brought him joy for decades. Robert had tried multiple conventional treatments, including steroid injections, prescription pain medications, and even considering surgery for his worst affected joints. The medications provided temporary relief, but left him feeling foggy and disconnected, while the steroid injections were both expensive and painful with diminishing returns over time. When I introduced Robert to the pressure point technique, he was initially doubtful because he associated effective treatment with more intensive interventions. However, within 2 weeks of consistent practice, Robert began experiencing improvements that surprised both of us. His grip strength increased significantly, his morning stiffness decreased to manageable levels, and most importantly to him, he was able to return to his woodworking projects with modifications that accommodated his improved but still somewhat limited hand function. Robert described the technique as giving him back his life, allowing him to engage in activities that defined his identity and brought him happiness. The scientific research supporting this approach continues to grow as more healthcare providers recognize the limitations of purely pharmaceutical approaches to chronic pain management. A landmark study published in the Journal of Alternative and Complementary Medicine followed 120 patients with hand osteoarthritis who used pressure point massage techniques similar to what I am teaching you today. After 8 weeks of consistent practice, participants showed statistically significant improvements in pain levels, joint flexibility, grip strength, and overall quality of life measures compared to control groups receiving standard care. What particularly impressed the researchers was that these improvements were maintained at follow-up visits 6 months later, suggesting that the benefits of pressure point massage are not just temporary symptom relief, but actual improvements in joint function and health. Understanding why this technique works so effectively requires recognizing that arthritis is not just a mechanical problem of worn-out joints, but a complex interaction between inflammation, circulation, nerve sensitivity, and muscle tension. The pressure point between your thumb and index finger connects to meridian pathways that influence all of these factors simultaneously. When you stimulate this point correctly, you are essentially sending a message to your nervous system to rebalance these interconnected systems in a way that promotes healing rather than perpetuating pain and dysfunction. This is why many patients report improvements that extend beyond just pain relief to include better sleep, reduced anxiety about their condition, and increased confidence in their ability to manage their symptoms naturally. Now, I want to address some concerns you might have about trying this technique. First, you might wonder if it will work for your specific type of arthritis or the severity of your symptoms. In my experience, this pressure point massage is effective for various forms of hand arthritis, including osteoarthritis, rheumatoid arthritis, and psoriatic arthritis, though the degree of improvement may vary based on individual factors. The technique is safe for people of all ages and can be particularly beneficial for those who prefer natural approaches or who have experienced side effects from conventional medications. However, it is important to understand that this is not a replacement for proper medical care, especially if you have inflammatory conditions that require ongoing monitoring by healthcare professionals. Some patients ask me whether they can perform this technique too often, or if there are any risks associated with daily use. The beauty of pressure point massage is that it works with your body's natural systems rather than overriding them, which means that regular use actually enhances its effectiveness rather than creating dependency or tolerance issues. You can safely perform this technique multiple times throughout the day whenever you need relief, though I typically recommend starting with twice daily sessions to establish a consistent routine. The only precaution I advise is to avoid applying excessive pressure that causes sharp pain rather than therapeutic discomfort. The goal is to stimulate the pressure point, not to force a response through aggressive manipulation. It is also worth noting that this technique often works synergistically with other natural approaches to arthritis management. Many of my patients combine the pressure point massage with gentle hand exercises, anti-inflammatory dietary changes, and stress reduction techniques to create a comprehensive approach to joint health. The massage can actually enhance the effectiveness of these other interventions by improving circulation and reducing baseline inflammation levels, creating an environment where other healing modalities can work more effectively. I want to take a moment to acknowledge the emotional impact of living with chronic hand pain, because this is something that conventional medical training does not always prepare healthcare providers to address adequately. When your hands no longer work the way they should, you lose more than just physical function. You lose confidence, independence, and sometimes even your sense of identity if your hands are central to your work or hobbies. The isolation that comes with chronic pain can be profound, especially when others cannot see your struggle and may not understand why simple tasks have become so challenging for you. This pressure point technique offers more than just pain relief. It offers hope and empowerment, giving you a tool that you can use to actively participate in your own healing rather than feeling helpless and dependent on treatments that may or may not work. Many patients tell me that learning this technique marked a turning point in their relationship with their arthritis. Instead of feeling like passive victims of a progressive condition, they began to see themselves as active participants in their healing journey. This shift in perspective often leads to other positive changes, such as better adherence to beneficial lifestyle modifications, increased willingness to stay physically active within their limitations, and improved overall mental health as they regain a sense of control over their symptoms. If you found value in learning about this pressure point technique, I want to invite you to subscribe to the Lauren Wellcare channel, where I share evidence-based natural health solutions that respect both your intelligence and your experience. I understand that you have probably been disappointed by health advice before, and I want you to know that every video I create is designed with your specific needs in mind. This channel is not about offering false hope or oversimplified solutions that ignore the complexity of chronic health conditions. Instead, it is about providing real, science-backed approaches that honor your struggle, while empowering you with practical tools that can make a meaningful difference in your daily life. When you subscribe, you are joining a community of people who understand what it feels like to live with chronic pain, people who are committed to finding natural solutions that work with their bodies rather than against them. You will never be judged for your limitations or offered patronizing advice that ignores the reality of your experience. Instead, you will find compassionate, expert guidance that treats you as a whole person deserving of genuine relief and improved quality of life. The subscription is completely free, and you can unsubscribe at any time if the content does not meet your needs. I see this not as a transaction, but as the beginning of a partnership in your healing journey, where you are not a passive recipient of information, but an active participant in discovering what works best for your unique situation. I promise that I will never waste your time with repetitive content or unrealistic promises. Every video will provide actionable information that you can implement immediately, along with the scientific context that helps you understand why these approaches work and how to modify them for your specific circumstances. As you begin incorporating this pressure point massage into your daily routine, I want you to pay attention not just to changes in your pain levels, but to subtle improvements in your overall hand function and quality of life. You might notice that you can hold a coffee cup more comfortably, that buttoning shirts becomes slightly easier, or that you feel more confident about using your hands for activities you had been avoiding. These seemingly small changes often add up to significant improvements in your ability to live the life you want, rather than the limited life that chronic pain has been forcing you to accept. I encourage you to be patient with yourself as you learn and practice this technique. Like any new skill, it may take a few sessions before you feel completely comfortable with the pressure and timing. Some people experience immediate relief, while others notice gradual improvements over the course of several days or weeks. Both patterns are completely normal and do not indicate anything about the ultimate effectiveness of the technique for your particular situation. The key is consistency and paying attention to your body's responses so you can adjust the pressure and frequency to optimize your results. Before we conclude, I want to address one more important aspect of this approach. While this pressure point massage can provide significant relief for many people with hand arthritis, it is not intended to replace comprehensive medical care, especially if you have inflammatory conditions that require ongoing monitoring. I always encourage patients to work with their healthcare providers to develop integrated treatment plans that combine the best of conventional and natural approaches. Many doctors are increasingly open to complementary therapies, especially when patients can demonstrate that these approaches are providing meaningful benefits without interfering with necessary medical treatments. If you decide to discuss this technique with your healthcare provider, you can explain that you are using a traditional acupressure point that has been validated by modern research for pain management and circulation improvement. Most medical professionals will be supportive of safe, non-invasive approaches that help patients manage their symptoms more effectively, particularly if these techniques allow for reduced dependence on medications that carry potential side effects. Remember that healing is rarely a linear process, and managing chronic arthritis often requires multiple strategies working together over time. This pressure point massage is a powerful tool, but it works best as part of a comprehensive approach that might also include gentle exercise, stress management, proper nutrition, adequate sleep, and appropriate medical care when needed. Think of it as one important piece of a larger puzzle rather than a standalone solution to a complex health condition. I hope that this technique brings you the relief and empowerment that it has provided for so many of my patients over the years. Your hands have served you faithfully for decades, and they deserve compassionate, effective care that honors their importance in your daily life. You deserve to wake up each morning feeling hopeful rather than dreading the pain that has been your constant companion. You deserve to engage fully in activities that bring you joy and fulfillment without constantly worrying about whether your hands will cooperate. This simple, one-minute technique might seem too easy to address such a complex problem, but sometimes the most profound healing comes from working with your body's natural wisdom rather than fighting against it. I want to share one more remarkable case that demonstrates the profound impact this simple technique can have when practiced consistently. Sarah, a 54-year-old artist, came to my practice devastated because her hand arthritis was forcing her to consider giving up the painting that had been her passion and livelihood for over 20 years. She described the heartbreak of watching her once steady hands shake and cramp whenever she tried to hold a brush for more than a few minutes. Sarah had tried everything her rheumatologist suggested, including powerful disease-modifying drugs that came with serious side effects and monthly blood tests to monitor her liver function. Despite these aggressive treatments, her hand pain and stiffness continued to worsen, and she was beginning to accept that her artistic career was over. When I taught Sarah the pressure point technique, she initially dismissed it as too simple to help with such a complex autoimmune condition. However, she was desperate enough to try anything, so she committed to performing the massage religiously twice daily. Within 10 days, Sarah began noticing that her hands felt more relaxed and flexible in the mornings. By the third week, she was able to hold a paintbrush for progressively longer periods without the cramping that had been limiting her work. 6 months later, Sarah had not only returned to painting, but had completed her most ambitious series of works in years. She credits the pressure point massage with giving her back her identity and livelihood, describing it as the missing piece that allowed all her other treatments to work more effectively. What makes Sarah's story particularly compelling is that she learned to modify the basic technique to address her specific needs as an artist. She discovered that performing the massage immediately before painting sessions seemed to provide optimal results, and she began incorporating gentle circular motions around the pressure point in addition to the standard on and off pressure pattern. This personalization of the technique illustrates an important principle that I want to emphasize. While the basic method I have taught you is highly effective as presented, you can and should pay attention to your body's responses and make small adjustments that enhance your results. Some of my patients find that holding the pressure slightly longer works better for their particular type of pain, while others discover that alternating between firm and gentle pressure creates more lasting relief. The key is to maintain the fundamental principle of stimulating the Li4 point while allowing your body to guide you toward the specific approach that provides maximum benefit. Another aspect of this technique that makes it so valuable is its ability to interrupt the cycle of pain-related stress that often amplifies arthritis symptoms. When you live with chronic hand pain, your nervous system becomes hypervigilant, constantly scanning for signs of discomfort and often creating muscle tension that makes the underlying joint inflammation worse. This creates a vicious cycle where pain creates stress. Stress increases muscle tension, and increased muscle tension amplifies pain signals. The pressure point massage works on multiple levels to break this cycle by providing immediate pain relief, activating your body's relaxation response, and giving you a sense of control over your symptoms that reduces anxiety and helplessness. Dr. James Chen, a pain specialist at Stanford University Medical Center, has published extensive research on the neurological mechanisms behind pressure point therapy for arthritis. His studies using functional MRI imaging show that stimulating the Li4 point creates measurable changes in brain activity within minutes of application. Specifically, areas of the brain associated with pain processing show decreased activity, while regions involved in producing natural pain-relieving chemicals show increased activation. This research provides scientific validation for what traditional Chinese medicine practitioners have observed clinically for thousands of years: that specific pressure points can literally rewire your nervous system's response to chronic pain in ways that pharmaceutical interventions often cannot achieve. What particularly impressed Dr. Chen and his research team was that these beneficial brain changes appeared to become more pronounced with repeated use of the technique over time. This suggests that unlike pain medications, which often become less effective with long-term use due to tolerance effects, pressure point massage actually becomes more powerful as your nervous system learns to respond more efficiently to the stimulus. This explains why many of my patients report that their initial modest improvements from the technique often evolve into dramatic symptom reduction after several weeks or months of consistent practice. I want to take a moment to address a concern that some people have about using natural techniques like pressure point massage for serious medical conditions. There is sometimes a misconception that choosing natural approaches means rejecting modern medical care, or that healthcare providers will disapprove of patients exploring complementary therapies. In my experience, this is rarely the case, especially when patients approach these techniques as additions to, rather than replacements for appropriate medical care. Most rheumatologists and primary care physicians are supportive of safe, evidence-based complementary therapies that help their patients achieve better symptom control and improved quality of life. In fact, many medical centers now integrate acupressure and massage therapy into their standard arthritis treatment protocols because research consistently shows that patients who combine conventional medical care with appropriate complementary therapies often achieve better outcomes with fewer side effects than those who rely solely on pharmaceutical interventions. The pressure point technique I have taught you today represents exactly this kind of beneficial integration, a scientifically validated approach that enhances rather than conflicts with standard medical care. Let me share the story of David, a 67-year-old retired mechanic whose experience illustrates how this technique can work synergistically with conventional treatments. David had been managing rheumatoid arthritis for over 15 years with a combination of disease-modifying drugs and periodic steroid treatments. While these medications had prevented his condition from progressing rapidly, he still experienced significant daily hand pain and stiffness that limited his ability to enjoy retirement activities like gardening and working on classic cars. When David learned the pressure point technique, he initially used it primarily for breakthrough pain between his scheduled medication doses. However, he soon discovered that the massage seemed to enhance the effectiveness of his existing treatments, allowing him to achieve better pain control with slightly lower medication doses. Over time, working closely with his rheumatologist, David was able to reduce his steroid use significantly while maintaining improved symptom control through the combination of his medications and daily pressure point massage. His rheumatologist was so impressed with David's progress that she began recommending the technique to other patients in her practice. Now, I want to address some practical questions about implementing this technique in your daily routine. Many patients ask me about the best times of day to perform the pressure point massage for optimal results. While the technique is effective whenever you use it, I have observed that most people benefit from establishing regular morning and evening sessions. The morning session helps prepare your hands for the day's activities by improving circulation and reducing the stiffness that often accumulates overnight during periods of inactivity. The evening session serves a different but equally important purpose, helping to release tension that has built up throughout the day and promoting the relaxation response that supports healing during sleep. Some of my patients have found creative ways to integrate the technique into existing daily routines to ensure consistency. For example, Margaret, the teacher I mentioned earlier, performs her morning session while her coffee is brewing and her evening session while watching the news before bed. Robert, the carpenter, does his massage during his lunch break and again after dinner while relaxing with his family. The key is finding times that work with your existing schedule rather than trying to create entirely new routines that may be difficult to maintain long-term. It is also worth noting that this technique can be particularly helpful during flare-ups of arthritis symptoms when pain and stiffness become more severe than usual. During these challenging periods, you can safely increase the frequency of the massage to 3 or 4 times daily without any risk of overuse or adverse effects. Many patients find that using the technique at the first sign of increased symptoms can help prevent minor flare-ups from developing into more severe episodes that might require additional medical intervention. I want to share some additional insights about why this particular pressure point is so effective for hand arthritis compared to other acupressure points that might seem more directly related to the hands themselves. The Li4 point, located in the web between your thumb and index finger, is what traditional Chinese medicine calls a source point for the large intestine meridian. This meridian pathway influences not just the obvious connections to digestive function, but also circulation, immune function, and pain processing throughout the arms and hands. When you stimulate this point, you are essentially accessing a master control center that can influence multiple systems simultaneously rather than addressing only local symptoms. Modern research has identified several specific mechanisms that explain why stimulating this point provides such comprehensive benefits for hand arthritis. First, the point lies directly over the first dorsal interosseous muscle, which, when relaxed through pressure point massage, reduces tension throughout the entire hand and wrist complex. Second, the location corresponds to a convergence of nerve pathways that carry pain signals from throughout the hand, making it an ideal location to interrupt these signals before they reach the brain. Third, the rich blood vessel network in this area means that improved circulation achieved through massage has immediate effects on nutrient delivery and waste removal throughout the hand and fingers. Let me describe a simple way to enhance the basic technique that many of my patients have found helpful. After completing the standard 1-minute massage on each hand, you can extend the benefits by performing gentle hand and wrist movements while the increased circulation and reduced pain sensitivity are at their peak. Simple exercises like slowly opening and closing your fingers, making gentle fists, and rotating your wrists can help distribute the improved blood flow throughout all the joints while the nervous system is in its most receptive state for movement. These movements should never cause pain. but you may notice that your range of motion feels improved immediately following the pressure point massage. I also want to address the question of whether this technique can help with specific types of hand arthritis that may be reading this information. The pressure point massage is beneficial for the most common forms of hand arthritis, including osteoarthritis, which results from wear and tear on joint cartilage, and rheumatoid arthritis, which involves autoimmune inflammation of joint tissues. Patients with psoriatic arthritis, fibromyalgia affecting the hands, and even those recovering from hand injuries or surgeries have reported significant benefits from regular use of this technique. The universality of the approach stems from its effects on fundamental processes like circulation, nerve sensitivity, and muscle tension that are involved in virtually all types of hand pain and stiffness. However, I do want to emphasize that while this technique is remarkably safe and effective, it should be viewed as one important component of comprehensive arthritis management, rather than a standalone cure. The best outcomes typically occur when patients combine pressure point massage with appropriate medical care, gentle exercise, stress management, adequate sleep, and attention to nutrition factors that can influence inflammation levels. Think of the massage as a powerful tool that enhances your body's ability to benefit from all these other health-promoting activities. The emotional and psychological benefits of mastering this technique should not be underestimated. Many patients tell me that learning to provide effective pain relief for themselves represents a profound shift from feeling helpless and dependent to feeling empowered and capable. This change in mindset often extends beyond arthritis management to other areas of health and life, creating a positive cycle where increased confidence and reduced anxiety contribute to better overall well-being and improved treatment outcomes. Take a moment now to try this technique on both hands, following the instructions I provided earlier. Notice how your hands feel before and after the massage, paying attention to any changes in pain levels, flexibility, or general comfort. Even if the improvements are subtle at first, remember that you are beginning to retrain your nervous system and improve circulation in ways that will compound over time with consistent practice. This is your first step toward reclaiming control over your hand pain and rediscovering the confidence that chronic arthritis has been stealing from you. Your journey toward better hand health and improved quality of life begins with this simple but powerful act of self-care. Remember that healing is a process, not an event, and every time you perform this massage, you are investing in your long-term health and freedom from pain.